Hello everyone, my name is Stephanie Daniels. I'm a physical therapist at Chia Freddy Physical Therapy. I specialize in pelvic floor physical therapy, and today I wanted to talk to you about abdominal care and its relationship to the pelvic floor and bowel health. My plans today are to go through an orientation to what the pelvic floor is and what it does. Also talk about proper breathing, show you 4 stretches that can help with bowel health, and then also teach you an abdominal massage technique. To start off with, this is a model of a female pelvis. There are differences between the male and the female pelvis, but many of the muscles are quite similar. So there's just a couple of variations, obviously, in terms of the genitalia. So if we look at the pelvis from straight on, in the very front, we have the pubic bone. On the right and left sides, we've got the hip bones. And then if we turn the model to the back, we've got the lumbar spine, the sacrum, the SI joints, and then the tailbone right down here at the back. If we flip the pelvic model upward, what you're looking at is the superficial anatomy of the female pelvic floor. All of the red lines that you see surrounding the pelvis and the opening to the pelvic floor, including the urethra, the vaginal opening, and the anal opening, are the superficial pelvic floor muscles. The pelvic floor as a group has the superficial layer, and then if we take off this first layer, we can see the deeper pelvic floor. This is also called the levator ani. It's made up of a group of muscles that are called, that each have names, sorry. So you've got the puborectalis, which is the most midline. We've got the pubococcygeus, we've got iliococcygeus, and then the coccygeus muscle is way in the back there. As a group, the pelvic floor controls continence. If they do a Kegel, for example, you are attempting to stop loss of urine, gas, or feces. If you are talking on the other end, though, if we're talking about ease of bowel movement, urination, or anything that might require an internal assessment, such as a pelvic exam, those muscles have to also be relaxed enough to be able to allow for ease of urination, ease of bowel movement as well. Also ease of pain-free penetration for a pelvic exam or for intercourse. They also provide a large role in stabilizing our bodies when we're upright, when we're exercising, walking, moving around, lifting. They provide support to our pelvic organs. So if you look at the model from the side, you could have a nice understanding of how the rectum, which sits in the very back, the uterus and the vagina in a female, and the bladder, which is in the very front in a female, would provide good support to our pelvic organs. Those are what those are called in our body. And then they also have a huge role in our sexual function. So when we're talking about bowel health, what we're really talking about are 2 ends of the spectrum. So if we're talking about being able to stop leakage or being able to allow for ease of bowel movement and passage of stool through the body. So when we're talking about either of the 2 of those, if we're teaching someone to strengthen their pelvic floor or we're teaching someone to relax their pelvic floor to have an easier time of having a bowel movement, one of the things that we focus a lot on is the breath. In our body, we've got our diaphragm, which sits up at the very top. I'm going to come up here just so you can see me a little bit better. Underneath our rib cage, which if you reach around your sides, this is your rib cage here. Underneath our rib cage, we've got the diaphragm muscle, which sits at the very top. Surrounding our abdominal canister, which is very much what the deep core is likened to as a canister, would be all of our abdominal muscles. The transverse abdominis, which is the deepest layer of the abdominal wall, runs horizontally around our abdominals and attaches back into our spine. The fibers are oriented horizontally, much like a corset. And then at the very bottom, I'm going to hold the pelvic model up here, would be the pelvic floor. So we're talking about diaphragm at the top, pelvic floor at the bottom, abdominals all around the side. So our breathing is very much integrated into the abdominal and the pelvic floor function, which all kind of works in together. So when we inhale, what happens at the diaphragm is that muscle, which the diaphragm is a muscle, that contracts and it flattens down. The pelvic floor follows the diaphragm. So when we inhale, if the diaphragm descends down, the pelvic floor follows it and that descends down. When we exhale, the diaphragm rises up into its dome-shaped. The pelvic floor follows it. So we've got a nice pattern of inhale, exhale, inhale, exhale, inhale, exhale. So anytime we're teaching someone to do a Kegel, for example, we're teaching them to do it on the exhale. For people who have trouble with having ease of urination, ease of having a bowel movement, we're going to teach a little bit more focus. If the problem is relaxation, we're going to focus on how well they're able to inhale and relax their pelvic floor. Let's say that that is a problem. So what I want to go over with you today is how to do proper breathing mechanics, which can actually help with bowel function and can help with promoting some movement within our colon. So in order to start with that, I'm going to have a seat back on the floor here, and I want you to you can sit in a chair to do this, you can sit on the floor, you can sit on your bed, wherever is the most comfortable position for you. And use my pelvic model here to assist. So these bones at the very bottom are called our ischial tuberosities. A lot of us refer to them as our sit bones. So if we are sitting pretty upright, and if my hand is the floor, the ischial tuberosities or your sit bones would be pretty much resting on the floor. If I really slouch my posture back like this, I'm going to be resting a little bit more on my sacrum. If I really tilt forward and arch my low back, I'll be a little bit more forward onto my pubic bone. I'm just going to adjust my camera here a little bit just so you can see me a bit better. Okay, so if we do this from the side, I want you to try just playing around with that angle a little bit. So I want you to really rock back, rock back onto your sacrum, sit nice and upright. You should feel a little bit more contact in the ischial tuberosity area on the floor or the sit bone area. And then if you really rock forward, this would be a little bit easier to feel if you were in a chair. You might feel a little bit more contact of your pubic bone on that chair. So just try a couple of rock back, rock forward, and just bring your attention to that sit bone area that I pointed out to you on the model. See if you can feel the pressure of those bones on the surface that you're sitting on. Okay, that's the first thing. That getting that bony orientation can help with just trying to figure out the area of the body that we're trying to feel. Breathing with the pelvic floor is a very subtle movement. So it can be difficult to appreciate at first and is very much an awareness exercise that we're teaching when we're focusing on proper breathing mechanics. Okay, so the next area that I want you to focus on is what we call the perennial body area or the perineum. Perennial body is just in a female is this meeting of the superficial and some of the deeper, intermediate and deeper layers of the pelvic floor that comes together. I'm a little bit more superficial oriented. And then this whole area, the soft tissue area in between your sit bones is what we call the kind of perennial region. This is the area that we're feeling for when I was in kind of showing you with my hands, and you inhale and it drops down and you exhale and it rises up. This is that area that you're feeling for when you're doing your breathing exercise. Okay, so inhale, when you inhale, you should focus on that area, that perennial area. Take a deep breath in and see if you can feel any increase in pressure or if you can feel that perennial area a little bit more on the floor. And then exhale, let it go out. Now, when you're exhaling, you're not contracting your pelvic floor. You're not doing a Kegel, is what I mean by contracting. We're just letting that pelvic floor rise and fall naturally with your breath. Another way that a couple of other techniques that you can use to help, number one, get your breath correct. We're focusing on an abdominal diaphragmatic breath. And we're focusing on, when we're talking about that, we're focusing on an inhale and letting the abdominals come out. Exhale, they're going to naturally kind of fall in. Inhale, exhale. So you can put one hand on your abdominal region, focusing on a deep belly breath inhale, and then exhale. Inhale, exhale. Now, when you're sitting up, it can be a little bit harder to feel a really big expansion through your abdominals. Sometimes it can help if you lay down on the floor or on your bed. That's another option as well. Okay, so we're just focusing on our breath. Part one of the component, aside from the perineal region that I showed you, is the perineum, and then, the abdominals is the second part. So abdominals and perineum. For the perineal region, one technique that you can use is to take a towel, just a hand towel, roll it up, and then place it in between the two sit bones. Basically, that just increases the pressure there, which can help you feel a little bit more of that contact when you inhale. So again, let's take our hand over the abdominals. Okay, that's focusing on getting that good belly breath in. And exhale. Let's do a 4-second inhale. And exhale. Inhale, 2, 3, 4. Exhale. Inhale. Exhale. Let's do one more inhale. Exhale. Good. So that is proper breathing. You can do a counting technique if you want to. 4-second inhale, 4 to 6-second inhale. Hold it for a few seconds and then exhale 7-8 seconds, just to kind of try to get that pattern down. You can do it in repetitions, 10 to 20. You can do it for 5 minutes or so. Lying down, you may be a little bit more relaxing for you. Good technique to do at night. And basically what the goal of the breathing exercise is to help you coordinate the abdominal expansion with the pelvic relaxation. So trying to get the coordination of the breath up and down, movement of the pelvic floor. So inhaling down of the pelvic floor, exhaling, rising of the pelvic floor. And then you're using your abdominals to coordinate along with that, because all of the abdominals, the pelvic floor, and the diaphragm coordinate together. Okay. All right, so next section, we're going to work through some stretches that can help with aiding in digestion. The first one is called a seated twist. With all of the stretches that I'm showing you, I'm just showing you one hold for each. You can do 15 to 30 seconds of holding on each stretch, and then you can complete 2 to 3 repetitions of each. So with the first one, I'm going to cross my left leg over my right, hang on to my knee here with my right arm. Sit up nice and tall, bring my left hand behind me, inhale, exhale, and twist. And then while you're holding here, wherever you can comfortably get, whether you're here or you're deeper into that twist or just breathing, just deep inhaling and exhaling. Inhale, exhale. And then we're going to inhale, come out of that, switch over, bring the right leg over the left, sit up nice and tall, hang on to my right knee with my left hand, right arm comes behind me, inhale, sit up nice and tall, exhale, and twist. And again, we're inhaling deeply into the belly as much as we can, and exhaling. And coming out of that, the second stretch we're going to do is called Cobra Pose. So we're going to lay on our stomach, bring the hands under the shoulders, stretch out through the spine, inhale, exhale, lift up, and breathing here. Bring the shoulders away from the ears. And come down out of that. The next stretch to follow that, we're going to flip over onto our back. This is called Happy Baby Pose. I'll show you a couple of variations with this. If you have good range of motion in your hips, knees, ankles, and arms, bring the knees up, out, hang on to the bottoms of the feet. If this isn't possible, then just bring your hands down behind your knees and use your arms to pull the knees up and out. And then while we're here, you're inhaling and exhaling. When you're in this position, this is a good time to have feel that pelvic breath, meaning inhaling and the pelvic floor moving away from you. In this position, the pelvic floor tissue is on tension, so sometimes it can be a little bit easier to feel that movement in the pelvic floor with your breath if you really tune into it. And exhale. All right. The last stretch that you can do, which helps with opening up through the pelvic floor, is called the deep squat. If you don't have good range of motion through your hips, knees, and ankles, then this may not be a good stretch for you. If you do otherwise, I'll show you how to get into that. So you're just going to come up and squat down deeply here. Bring the arms inside of the knees. And again, because the pelvic tissue is on tension here, this can be a good position to feel the pelvic floor moving downward towards the floor with your inhale. Let's take a couple of deep breaths here. So inhale, exhale. Keep your breath going here. Inhale, exhale. These are good stretches to do before you climb into bed at night, and then finish up with your diaphragmatic breathing and abdominal massage, which I'm going to show you next. These are also good stretches to do before you go into the restroom to have a bowel movement. All right, and we'll come out of that. The last portion of the video is going to teach you the abdominal massage. The purpose of the abdominal massage is to help stimulate motility in your colon or your large intestine. So we're going to start by just figuring out our landmarks. If you take your hands and bring them over your hip bones here, this is my right and this is my left hip bone. This is the lower border. If you bring your hands up around your lower rib cage here, this is going to be the upper border. The colon or the large intestine starts on the right side of your body. It goes up. This is called the ascending colon. Then it turns and goes horizontally towards the left. And then that's called the transverse colon. Then it dives down from there. This is the descending colon on the left side. So it runs from right to left. I'm going to show you the abdominal massage with me lying on my back, so it's a little bit easier to see what I'm doing, but essentially you want to follow that pattern from right to left in a clockwise fashion. So for the abdominal massage, I usually like to start on the left side. This is my left over here, and just massage down in the sigmoid colon. That's the last part of the large intestine. Just to kind of loosen that up, you can do this for a couple of minutes here. I'm showing you over my clothes, but you can grab some hand lotion and do it directly over your skin. Okay, and then from there, we're going from the right, coming up, over towards the left, and then back down. So you're just following this motion with pressure that's comfortable for you. Probably about a medium amount of pressure would be good for this. You can go in circular motions, coming up in this direction. Again, just remembering you want to come from the right, go up, move over towards your left. This would be what the circular motion looks like. And then coming down towards the left. If you're doing that sweeping motion, you're just going to come out and up from the right, come over from right to left, and then sink back down and just do some sweeping motions with that. If you find any areas of soreness, you can stay there and kind of work it a little bit. Sometimes this area can feel a little bit sharp, so go with pressure that's comfortable for you. And then you're just sweeping up and over and down. And you can spend about 5 to 10 minutes on this before you go to bed at night. It's a good way to relax. Typically what I would recommend is to do your stretches first before bed, climb into bed, do about 5 minutes of the diaphragmatic breathing with the pelvic floor dropping down. So remember, inhaling and dropping down, and then finish up with about 5 to 10 minutes of the abdominal massage, and then you'll be good and ready for bed. All right, everyone, so that was the abdominal massage. Just as a general review, pelvic floor and the abdominals have to coordinate together. Ways to practice good gut health are managing stress, doing some of the diaphragmatic breathing, the stretches that we went over, abdominal massage, keeping activity levels up, so doing some aerobic activity and the stretches that we showed, getting good, adequate fiber intake that's appropriate for you, good water intake, and managing all of that together. Those are just some of the things that can impact our gut health and our bowel health. Last but not least, we didn't go over this yet, but one of the things that's really helpful for actually passing stool and making everything kind of work well in line with all of the anatomy would be to use a squatty potty at your toilet. They do sell them online. It's Squatty Potty, but you can also use a stool at home if you've got a footstool handy. And I will post a picture along with this video of just how to sit on a chair or a toilet, really, with your feet up on a stool. It's really, if you think about it, the same position, knees above the hips, feet out wide. And again, I'll post a picture to show you that. Thank you everyone for watching, and have a great day and take care of those bellies. Bye.